Hi everyone, I'm Danilo Buonsenso, a pediatrician from Gemelli University Hospital in Rome, Italy, with a specific training in pediatric infectious diseases. As a pediatrician involved in pediatric infectious diseases, since the beginning of the pandemic, I've been involved in following children initially with acute COVID-19. Then we had to face the scenario of the multisystem inflammatory syndrome in children, which is another post-acute complication of COVID-19, but likely acute COVID and the multisystem inflammatory syndrome has incredibly decreased during the pandemic, probably due to immunity, either from natural infections or from vaccination, or even changes about the virus. What has not dramatically changed during these 4 years of the pandemic is long COVID. As some of you may know, I've been actively involved in the research and care of patients with long COVID, particularly children and adolescents up to 18 years of age. I started seeing patients with long COVID around May or June of 2020. Soon after, my colleagues from my hospital working with adult patients described published the initial studies about long COVID in adults. And I was kind of surprised when during the second half of 2020, so it's about 4 years now, 4 years later now, I began seeing more and more patients, children and adolescents that were presenting with a very similar clusters of signs and symptoms. There were children that were perfectly healthy before the pandemic. They were attending school very well, with good or normal results. They were playing, doing extrascholastic activities like playing football or volleyball or any other sports, playing music. And suddenly they had COVID, and since then their life completely changed. These children who were very much active before COVID started suffering about extreme fatigue, brain fog, muscle pains, chest pains, memory issues, and many palpitations and many other signs of symptoms, gastric pains, abdominal pains, and many other signs and symptoms that significantly impair their life. This means that these children who were playing sport or going to school, since that moment could not have a normal life. They are not attending school anymore, or only partially because of the extreme fatigue and the memory issues. They are not playing the extrascholastic sports or other activities. They are not going out with children, with other friends, because they suffer from post-exceptional malaise, and as they do not feel to be the same as they were before. And this, of course, is indirectly is also going to have a significant impact on their mental health, and indirectly also to parents and all family members, because these families suddenly found that their children were not the same as before. As a doctor actively involved since the beginning with these families and children, I've seen with my eyes the neglect that these families have suffered for years. And more importantly, this neglect and lack of recognitions of this condition not only happened in Italy, but it happened, and unfortunately is still happening everywhere in the world. I'm in contact with several family associations and colleagues all over Europe, North America, South America, but even Africa and Asiatic countries. And I'm hearing the very same stories, family, parents, teachers, but even doctors are not trusting these patients, believing that this all cluster of signs and symptoms is mostly a mental health implication due to social restrictions during the pandemic. But it's now more than 2 years that children are living a very normal life, and still new cases of long COVID are being diagnosed. Nowadays, as I was saying before, it's about 3 to 4 years that we know long COVID. And to be honest, I don't recall any other disease in the history of medicine that has been studied as much in details as long COVID. If you look on PubMed, we can find hundreds to thousands of publications, of very high quality publications on long COVID, most of them in adults, but still, and these publication studies published on the major journals like the New England Journal of Medicine, Nature, and Lancet, and all have documented through very high level and modern publications and studies like proteomic analysis, genomic profiles, microRNA profiles in peripheral blood, or even autopsy and biopsy studies. All studies have documented chronic persisting inflammation, thromboinflammation, viral persistence, immunological changes in patients with long COVID. And since 2 years now, we are having a growing evidence that similar events are also happening in children. I can just mention some studies from my team, but many others have done the same. We now have evidence that these children may suffer from dysautonomia, postural orthostatic tachycardia syndrome, chronic headache, have objective abnormalities at cardiopulmonary exercise testing that allows us to document that the fatigue and the muscular problems are real and not just in the mind of these patients. Offering this kind of care, so allowing these patients to enter initially a diagnostic step, first of all, allows us to do research, because it's important to keep doing research for children, but also help us to understand the condition, to support families in giving recognition that something objectively wrong is going on in these patients. And this also allows to do certificates to our patients that in turn allow, for example, assisted school time or any other of support, or even support from insurances, because the routine of these families is completely changed as compared before COVID. But most importantly, this test can allow the recognition of some treatable conditions. For example, the very classical example I do is POTS and dysautonomia, which, for example, we are having a growing experience in treating with ibabradine. We have a very good experience with PIA or gabapentin with chronic pains and chronic headache. And this is very important to mention, because still there are children suffering from chronic headache that still do not enter any care because they are not trusted and they are only sent to psychological assessments. If we keep doing research and if we keep recognizing this condition, we will have found, for example, to trial any other medications that can be repurposed to long COVID based on the recent discoveries. I can think at drugs with anti-inflammatory effects, biological medications, enoxaparin and other drugs acting on thromboinflammation, which is an event clearly documented in even in young adults with long COVID. The good thing is that some research centers are now working on this in Europe and in the United States. From my center, for example, we have just submitted a paper documenting that even children have a specific pro-inflammatory signature, children with long COVID. And therefore, I think that during these years, we have made several advances, and we are now close to closing the debate about it's real or not long COVID, but we are documenting that chronic inflammation is happening in these patients as well. And this is opening, this will open new scenarios in terms of potential treatments and even diagnostic tests. But to do so, we need to work all together and to recognize this condition And this is the reason why I'm very happy to support this Dutch Long COVID Day. Unfortunately, I could not travel during the days of this meeting, but I really wanted to show you, patients, families, but even doctors working in the field. I want to show you my support and to let you know all that we really need to move forward and not to give up. Not to give up. Days like this will help us to have our voices and patients' voices be heard from politicians and policymakers and founding agencies, because we now desperately need more funds to start pharmacological trials and to support these children and young adolescents which are suffering from long COVID. Of note, some of our patients are suffering from long COVID since years. We have many patients do well, some with some empirical treatments do well as well, but many remains without any cure. And in most countries in Europe, many families need to travel, need to wait to spend a lot of money in the desperate search for clinicians trusting them and supporting them with any treatments. We cannot allow that. We need to work. We are in 2024. We need to recognize on long COVID, work together in Europe, create network, and therefore really I hope this day, this first Dutch Long COVID Day, will be only the first and will allow you all to have the attention our patients and our families deserve. So good luck to everyone for this day, and if you need to contact me, many of you know that I'm available by email on danilo.buonsenso@gmail.com, or on my blog Buonsenso and the Kids, where I discuss the new updates in the field. So feel free to contact me if you may need my suggestion or collaboration. Bye bye.